Lung function is for gas exchange, allowing oxygen into the body during inspiration and getting rid of carbon dioxide during expiration. During inspiration, the diaphragm contracts and moves downwards, while the chest muscles and the rib move upward and outwards. This will generate negative pressure in the thoracic cavity and will suck air into the lung and allows maximum expansion of the lung. During expiration, the chest muscle and the diaphragm will relax, and the lung will revert to its normal size, pushing the air out. The air gets in from the nostril, enter the nasal cavity, which is lined by cell-releasing mucus, which is sticky, salty, and contains lysozyme to kill bacteria. The nose hair at the entrance of nasal cavity is coated by this mucus, which helps to trap the dust, pollen, and bacteria. There are paranasal sinuses, which is frontal, ethmoid, sphenoid, and maxillary, which helps the inspired air to circulate and makes it warm and moist. It also helps to amplify the sound of the voice, which explains why we sound kind of different when our nose gets clogged. This warm air will finally enter the larynx, will enter the throat, which is the pharynx, which is divided into nasopharynx, oropharynx, and laryngopharynx. The soft palate and the uvula will act like a valve to close the oropharynx to prevent food from going up into the nasopharynx. The epiglottis helps to close the larynx when we are eating, so that the food will go into the esophagus instead of the larynx. There are tonsil and adenoids located at the pharynx, which are part of the lymphoid system, which forms a ring of glandular tissue or Waldeus ring encircling the back of the throat. This functions in immune system as a defense mechanism against bacteria and viruses by forming antibody, especially in the first year of life. If the food enters the larynx, there will be cough reflex to remove the particle out. So from the larynx, air goes into the trachea, which is divided into the left main stem bronchus and the right main stem bronchus at the carina. The bronchus is divided into 2 to 3 generations before it finally divide into conducting bronchioles and terminal bronchioles. The right main stem bronchus is wider and more vertical, that makes foreign body likely to be dislodged at the right side as compared to the left side. The right lung 3 lobes and the left lung has 2 lobes, which is upper and the lower lobe. So the cells that line the trachea and the bronchioles consist of smooth muscle, which has a parasympathetic nerve and also parasympathetic nerve. When the sympathetic nerve fiber is stimulated, it will stimulate the beta-adrenergic receptor, which then will increase the diameter of the airway. When the parasympathetic nerve is stimulated, this will make the muscarinic receptor to be stimulated and will finally decrease the diameter of the airway. The cells are lined by ciliated columnar cell and also goblet cell. Goblet cell is important in secreting mucus, while the ciliated columnar cell will move the mucus towards the pharynx via mucociliary clearance, which will then the mucus will be spit or either will be spit or ingested. The bronchus divides into conducting bronchioles, which has no cartilage and consists of 15 to 20 generations. In addition to ciliary and goblet cell, it has a club cell which help to secrete glycosaminoglycans, which help to protect the epithelium and also help to regenerate and replace columnar cells. This will go into the terminal bronchioles and the respiratory bronchioles before it goes into the alveolar duct. There are about 50,000 of 100,000 in the lung. So it is lined by type 1 and type 2 pneumocytes. Type 2 pneumocytes help to secrete surfactant and regenerate or replace damaged cell. This will finally proceed into the gas exchange at the blood gas barrier. The blood from pulmonary artery will remove the carbon dioxide and will And while the pulmonary vein, the oxygen will go into the pulmonary vein, into the heart, and finally get pumped to the body.